So thank you very much. Welcome back from the lunch. I'm sorry it was relatively brief, but that's because we have a full and very exciting afternoon. We're going to start with Rebecca Fogg, who's going to tell us all about disruptive innovation. It will be followed by breakout sessions. So the idea is that we will ask you if you can go again outside, and you've all been allocated to a different table, which you can find in your program. And we will engage you in a discussion. We have people to take note. And then we will have Professor Carol Popper, summarizing your thought and giving you her expert views on this different area. Then we will finish the afternoon with two different types of panel. One where we have relatively newer player in the healthcare sector, and then another one where we have strategic and operational experts to tell you about delivery of healthcare and who's going to take the leadership. So now, James, please, I'll let you introduce Rebecca.
Okay. Just want to carry on this theme about disruptive innovation. I think one of the things that's come out this morning on a number of occasions and sort of theme that ripples through the discussions is this idea that certainly med tech and pharma is very, clearly a hugely important part of healthcare in the future. But actually, the real challenge is around business models and the delivery of healthcare services, and the need to rethink how we organise healthcare in a way that is affordable and delivers the best possible quality care. I'm very pleased to have Rebecca Fogg with us today from the Clayton Christensen Institute for Disruptive Innovation. Those of you who know Clayton Christensen's work, goes back 20 years now, and he was instrumental in getting this idea of disruptive innovation lodged in people's minds. And Rebecca's going to talk about what this means in the healthcare sector. Rebecca was, she was educated at Harvard. You're American, but she lives in London, and one of her hats involved founding the Institute for Pre-Hospital Care at London's Air Ambulance and working with London Air Ambulance to look at their ways of working. And she was also instrumental in developing and running the first undergraduate degree on pre-hospital medicine with Queen Mary University. She comes from a consumer financial services background, and Rebecca, I think over to you to give us an insight into disruptive innovation in relation to healthcare. And I think this will be a great scene setter for the breakout later on. Rebecca.
Thank you very much. Just want to make sure I don't back over that table there. Good afternoon. I'm really delighted to be here to share some insights from our work at the Institute, and I hope that they will inspire your brainstorming in the afternoon and also create a dialogue between us that could help shape our work at the Institute. So, what is disruptive innovation? You have probably noticed that people use the term in a lot of different ways, but it actually has a very specific definition. Disruptive innovation is not the kind of innovation that makes a good product even better. It's the innovation that takes a product that was historically so complex and costly that only a very relatively few people with a lot of money and a lot of skill could access and use it. And it transforms that product into something that is so simple and affordable that a much larger population of people can access and use it. Sounds like something we might need in healthcare, right? So how does that transformation happen? It doesn't require a miracle or particularly a lot of luck. But what's really important to understand is that it's not just about the product. So does anybody recognize this product here? Did anyone ever have it? Can I see you raise your hands? Okay. We have 3 people who know what the iMate Jam is. So the iMate Jam was released in 2004, and it was billed as a pocket PC. 2007. Anybody recognize this product? Anyone ever have one? Who has one right now? Can I see you raise your hands? Right, okay. So this is pictured actually, the first generation Apple iPhone. And it is the innovation that essentially created the smartphone category as we know it today. And smartphones are basically the latest wave of disruption in the computer industry. And they have made computing accessible to literally billions of people around the world. And they've made it so simple that pretty much the average 2-year-old can unlock the screen and start live streaming a Peppa Pig video in about the same time it takes Dad to remember his password. And that's disruptive. So that is an incredible phenomenon. And what we want to know when we understand all that is, why was it the iPhone and not the iMate Jam that created that wave of disruption? What was it about the iPhone? They were both cheaper and simpler, and they even had a similar set of features. So the reason, which we'll explain in a minute, is because it's not just about the product. It's about how you use the product to address a need that incumbents are ignoring. And on top of that, it's how you create a business model and wrap it around that product so that it's successful. The applications feature on the iPhone, which you're all familiar with, and actually Android uses similar business model now. The applications feature is a terrific illustration. So Jam users were basically stuck with the small set of applications that came loaded on their phone. On the other hand, Apple created an entire business model around the applications feature that essentially made the product infinitely customizable. And the result was that you have, let me back up a sec. So I'm going to tell you a little bit how they did that. So this was not a simple fix. This wasn't just about coming up with some kind of a pricing mechanism. So on the demand side, on the consumer side, Apple had to create the technology to easily download an application from the web onto the device. They had to create the App Store application. They had already in place a huge network of Apple stores that provided free support at the Genius Bar. All of those things together worked to help consumers want and shop easily for applications. Importantly, then there was also the supply side. So they created an entire community of developers that created this infinite supply of applications. And that also was a very involved situation. So it was developing technical specifications in a development kit so that the developers could develop for that platform. Intellectual property terms, payment terms, a whole host of processes and policies and assets that Apple needed to put in place so that they had this sustainable relationship with developers, sustainable, profitable relationship with developers, so that this product remained customizable. And the result was a digital marketplace with essentially an infinite solution set. And it became the indispensable tool so that people could solve almost any problem wherever they were in the world. And the result is that in late 2015, I think it was, the iPhone actually surpassed PCs in terms of global sales. That's an incredible story. Now, if you crack open the iPhone, you're not going to find developers. You're not going to find IP rules. You're not going to find any of that. That's business model development. It's not product development. Without all of that, it's pretty similar to the iMate Jam. Okay, it's more elegant, it's got swipe, there are some bells and whistles, but it's a much different animal when you wrap that business model around it. That's what made it different. That's what helped it trigger that wave of disruption. So that's the lesson that disruptive innovation teaches us. It's about competing differently. It's not just about the product. It's what do you use that product to accomplish, And how do you align every single part of the business model around that purpose to make sure that it's successful? So how do we compete differently in healthcare to make it more affordable and accessible? And that's to any payer, whether it's the government, whether it's the individual, whether it's an insurer. How do we do that? Same way you do it anywhere else. You need to use your product, your healthcare, to target a need in this circumstance that our existing system is not designed to address. And in healthcare, that need is going to be pretty specific. It's for care that helps individuals live the longest, healthiest lives possible in their particular circumstances. And then you need to create that enabling business model that allows that future to come true. When you do that, when you target that need, and when you create that enabling business model, the reason it's disruptive is because it creates the conditions in which innovation can can reduce the human and the economic burden of massive issues like chronic disease. That's how disruption can make healthcare more affordable. A disruptive solution creates the environment in which that kind of innovation can solve that kind of a problem. So let's apply our framework to an example. Is telemarketing, financial services, it just came back in that one instance. Is telemedicine disruptive? Depends entirely how you use it. If you use it to maximize utilization of your physician network in context of a fee-for-service environment, it's an improvement. It's the same as the existing system, but it doesn't disrupt it. On the other hand, if you use it to make it easier for a system and the consumer to collaborate over the long term in improving that person's individual health, then it could be disruptive. So the answer to any question of is this or that disruptive, it's always going to be it depends. How does it help you compete differently? So leading into a second insight, given all of this, where do we see interesting innovation brewing in healthcare, and particularly interesting in the area of consumer enablement, or as we might say, democratizing medical expertise? HealthTap is a digital platform that helps consumers assess the medical risk of any particular issue that they're experiencing at the first step in the pathway of care. The next company is something called Autism Beyond, and actually it's not commercialized yet. It's part of a Duke Medical Center research project, but what they've done is used Apple Research Kit to create an application that would enable a parent to show a video to their child, and through that process they're able to evaluate the emotional response of the child. And the objective would be earlier autism screening. The third example, in-home hemodialysis, that's actually not the prevailing method in the United States, but it's obviously something that allows a consumer to do something in the more familiar environment, the less expensive environment of their own home than going to a regional center. And then finally we have Iora Health, which is a primary care practice. The first three innovations, whether they're going to be disruptive or not, it'll depend on the context in which they use them, but they do have the potential to accelerate progress toward that future in the sense that they help consumers get the right care in the right place at the right time, given by the right resource, even if that's them. And by right in all of those circumstances, we mean it is the solution or the option that makes the largest contribution to long-term health for the least necessary cost. I'd like to spend a little bit of time on Iora because I think that's perhaps the most exciting example here, in the sense that they've developed their disruptive innovation and they've wrapped a business model around it, and they have some really interesting early results. So Iora is targeting that unmet need of long-term individual health for an entire population. And their disruptive solution is the relationship that they create between the system and the consumer over time. They use health coaches as the primary contact, the owner of that relationship, the owner and the developer of that relationship. And it's a very deep and trusting relationship that essentially allows, that the organization leverages to help move the patient along the continuum of self-care. So the entire clinical team supports the health coach, and in fact, you know, it's the clinical team, it's the payment method, it's the technology setup, it's the physical environment. All of that is designed to help the health coach understand what the consumer's world is like and come up with solutions that resolve their barriers to adopting healthy behaviors. That's really, really important in chronic care, and IORA focuses a lot on high needs population. And it's early days, they're only a little over 5 years old, but they're already seeing some really terrific results with some of those high needs populations. You know, blood pressure and diabetes control metrics are beating national standards by a long shot in some cases. So they have everything in place, we'll see what happens, but it is really inspiring because it shows us what's possible. So when you're thinking about solutions for the future, you know, building that ideal system in the 30 minutes that follow, if you can keep in mind, you know, when you're talking about what would disrupt this industry or what's the innovation that we need, what kind of innovation do we need? Are we solving a different problem than the incumbents? There's a lot of innovation focus around outcomes. Let's design everything to optimize outcomes instead of inputs or maximize transitions. That is certainly an improvement on focusing on transactions alone, but outcomes can still be very short term. And it's a lot of work, and there's a lot of innovation involved in figuring out how actually do we measure long-term health? How do we know where we are on that continuum? Population health management, also not a new idea. Really, really important. A big improvement on, you know, fee-for-service, transaction-focused care processes. But again, sometimes population health management can just be managing to the averages. And not one single person in this room is an average person. So, you know, the real solution is it pointed toward the long-term health of an individual in their given circumstances. So are we solving a different problem than the incumbents, and are we solving for the right problem? And then the second question is every element of our business model designed to do so, not just the product. You know, there's a lot of talk about profit model. It's table stakes. You know, does it reward resolution of that problem? If we are continually making progress toward resolution of that problem, do we have a sustainable operation? And then processes. You know, do we have processes for improving that product, for shopping and for using the experience? You know, one misperception can be that, you know, put in the right financial incentives, put in the right payment model, and then somehow magically we actually know how to achieve that goal, you know, but the incentive to achieve that goal does not create the capability to achieve that goal. So you've got to focus on care processes. That's part of the business model. And then there's innovative use of resources that keeps costs low. There's a lot of progress we can make there. That's something we understand we need to do. In the case of IORA, the health coaches are doing a fantastic job on something that nobody else needs to do. They can do it at the highest level, and they're less expensive than a physician. And that actually frees the physicians to work on the really tough problems that only they can do. This isn't a new idea, but it's hard to put in place, isn't it? Yeah. Oh, distributors who depend on our success and not our incumbents. So that has big ramifications. So it's about how do you make money, how do, you know, what makes your organization financially sustainable. If the organization you are dependent on to use your product, to prescribe your product, to market the product, if they're not making money the same way, there's going to be a disconnect. And that was a theme throughout. You know, it's about aligned incentives. So it's thinking about, you know, who else has to benefit from this solution for us to be sustainable? So I hope that those are some brief thoughts and some ideas that will shape your thinking, not just in the next session, but over time. And I would really enjoy hearing from you, your thoughts about the session and how it applies to your work. Thank you.